MIC at home or mobile inpatient care at home is an alternative inpatient care delivery model that offers clinically stable patients the option of being hospitalized in the comfort of their own homes. These patients will be cared for by a team of healthcare professionals who conduct regular teleconsultations and home visits. The level of clinical care patients will receive under this care model would be similar to that in a hospital.
When a patient's condition is deemed stable, after completing the necessary diagnostic tests, or when requested by the caregiver or patient, their primary clinician will assess their eligibility for MIC at home. If suitable, the clinician will confirm their treatment plans before the patient is sent home.
As patients are advised to remain at home, their treatment plans will be adapted to suit their living habits and home environment. This patient-centered approach ensures a more comfortable recovery and even promotes a smoother transition back to their pre-hospitalization lifestyle.
When I was admitted to MIC at home, I was a little worried at first. What's it like to be hospitalized but at home? How will the doctors and nurses take care of me and ensure I recover as compared to if I was in the hospital? But soon I could see that the care team was very well trained. The care team communicated clearly with me and explained to me things that I did not understand. This boosted my confidence and trust in them, and I knew I was in safe hands while recovering at home.
Apart from receiving medication and the necessary equipment right at our doorstep, I was pleasantly surprised that my daughter, Sophia, could receive IV drips at home, and she did not have to go to the hospital for blood tests. It was really convenient because I didn't need to make major work adjustments to bring Sophia to the hospital.
Recovering at home is less boring, as it gave me the freedom to do light tasks around the house. I could even work from home when I was feeling better and enjoy home-cooked food. I like to be around my family, and this also made it easier for them as they did not need to travel to the hospital to visit me.
Having 24/7 access to the care team eases my mind, because I know that I could get help from my mom anytime. If there were any emergency, I could easily get in touch with the care team for help. And they have always advised us promptly for our next steps. If they had noticed any abnormality in my mom's blood pressure or heart rate, they would immediately reach out to us and arrange for the necessary follow-up. When the relevant equipment was brought to our home, the care team was there to supervise the arrangement. They created a setup that was safe and comfortable for my mom's recovery at home.
Sophia and I were taught how to use the medical equipment, teleconsultation, and the monitoring devices so that the care team could reach us and we could record the readings accurately for them to monitor remotely.
After completing their treatment and a thorough assessment, fully recovered patients can be discharged from MIC at home and have their follow-up appointments arranged. Additional documents and medication will also be sent directly to their homes.
Patients enrolled under the MIC at Home program experience a much smoother and seamless discharge process without having to wait in a hospital for their medication and paperwork. On top of this, patients would have taken oral medication, applied topical creams, eye drops, and etc., and they could quickly adapt back to their daily routines.
With MIC at home, my mom didn't have to be away from her family and feel lonely in the hospital. I also didn't have to worry about her contracting infections from other patients. I'm grateful that she could recover comfortably at home and sleep well in her own bed.
The transition from the hospital to my home was easy. The care team made all the arrangements for me. Home recovery was also exceptionally comfortable and conducive.
Staying at home was comfortable because I could sleep on my own bed. Also, I could play jigsaw puzzles.
With the support from the Ministry of Health, MIC at Home has the capacity to benefit more patients and their caregivers. The MIC at Home program enables patients to recover in a safe and comfortable environment while receiving hospital-level care in their homes.